only the best gynecological services in all of Central Kentucky.
Best part of being on OB? Why'd you become an OB?
Get to deliver babies.
You get to care for women at all stages of life, from adolescence to elderly. There's a lot of difference in what we see in clinic. There's options to do clinic, procedures, surgeries. There's just a lot of variety.
Primary care plus surgery, the combo of the two.
No, so honestly, think about it. Like, I've been involved in a patient's life for like an hour in the delivery of their patient, and they're sending me socks as a gift to be like, thanks for delivering life into the world. It's crazy.
Oh, hi. So first off, as you can see here, we give you a nice tour of our facilities. We have the assistant to the regional resident, my right-hand man.
Jacob.
Yes, Chris, who's here to help us out and continue the tour.
Yes.
Come along. The highest technology that one could ask for. Built-in air conditioning units here, individualized for each nurse. These beautiful state-of-the-art rooms that we have here in our clinics. Just fantastic. I mean, you could not ask for a better.
Couldn't ask for more.
You couldn't ask for more, could you? I don't think you could.
Well, maybe more nursing staff.
Possibly, that's arguable, but yeah, that's probably true. Yep.
Up to date equipment.
Yep, I mean, it's the minor things, but here we strive on personality, perseverance, and perfection. Those are the three P's of Polk Dalton Clinic.
Ideally, every room would be set up in the same way. A sink to wash your hands before every patient encounter. In the drawers, we have pap smear supplies, brushes, endocervical brushes, Q-tips, a pipelle to do an endometrial biopsy, tape measures to measure a fundal height, and lab specimen collection kits. The orange one is a good one to remember because it's what we use for gonorrhea and chlamydia. Anaerobes and aerobes are in the purple one. Speculums come in different shapes and sizes. The more narrow ones are called Petersons.
All right, everybody just calm down. No one needs to get crazy. Count of 3, we lay down our weapons. 1.
I have speculums.
I have crossbows. 2.
Olivia, put down your weapon.
3. She's the worst.
The first thing that we'd like you to do at Polk Dalton is to come in and introduce yourself to the staff, to the residents that are working that day, and to the daily attending. Every day it's a different group of people, and so you'll have to introduce yourself every single day when there's new people coming in. The second thing is I would look at the schedule and then look at your required clinical experiences and decide which patient that you want to see that day. Maybe you haven't done a breast exam yet, and so you need to look at the schedule and see who needs an annual, and that way you can go in and see that patient either with a resident or you can do the beginning part of the history by yourself.
Have you had any pain?
¿Ha tenido dolor?
El año pasado me caí, tuve dolor.
Y luego, después de 3 meses, seguí con mucho dolor y luego se fue y otra vez me vino y luego se fue y ahora...
Pero la molestia es mucho aquí. Me duele aquí, me duele acá. So no sé qué tengo.
No.
When you see a patient, one thing to think about is, do you have time to write the patient up before you present it? That's a good way to solidify your ideas, put together a good differential, get all your thoughts put together, so that when you present it to the attending, it's a little more concise, it makes a little bit more sense.
Order the PDPOL.
Already did it. We have the abbreviations now. USS, uterus sacral suspension.
IOL is induction of labor.
Okay, let's see what else we got. TVH, total vaginal hysterectomy. RTLH, robotic total laparoscopic hysterectomy.
PNC, prenatal care.
PPROM, premature preterm rupture of membranes.
Very good.
It's when your water breaks early, before 37 weeks. IUGR,
LMFAO.
intrauterine growth restriction.
LOL.
What else, Casey?
PTO.
TTYL.
Oh yeah, PTL, preterm labor. Sometimes it's also POL, premature
POL.
onset of labor.
GCCT.
Yes.
GCCT.
Gonorrhea, chlamydia,
Not to be confused with BCTC,
GTFO.
which is a college here in town. Just gotta film again.
ROFL.
Oh, that's a good one. Rolling on the floor laughing.
Oh, I thought we were
TTYL.
doing a real.
T2IL, talk to you later.
ANCS is
BRB.
antenatal corticosteroids.
Prom.
Is Artem. We already did that.
A-ROM, S-ROM,
Prom.
spontaneous rupture of
PP prom.
membranes.
PPPP.
Don't ever say SHROM.
Shrom.
They shrommed.
AROM.
AROM.
Artificial rupture of membranes, aka breaking the water.
AKA breaking of the waters. If you're like waters, how many waters are there? Millions of little waters all strung together into one big water. Dr. Shimon.
SPP,
Super private patient. Yes.
That's a very important
yeah.
one. It's one of my favorites.
That's favorite. And sometimes they're attached
Every
to
med
physicians.
student should actually try to have their own SPP.
That's true.
Okay, if you could give advice to other people who don't do OB, so for example, your internal medicine consulting people or your, like, you know, other things that.
Afraid.
I got it.
Don't be afraid
Don't
of
do
the
a
perineum.
speculum exam.
Don't be afraid of the perineum.
Do
you can
a
look.
speculum exam.
You're a
before
primary
you call me.
care provider. You can do it. We believe in you. Just assess. If someone's bleeding,
Don't
Ask
just call
about
us
it.
right away.
ask about it. See what the
Also-
bleeding's like, and take a look. Take a look downstairs, and then give us a call.
And they shouldn't be afraid of pregnancy either. Like,
So I think, you know, this is a hard rotation, y'all. This is hard because it's so intimate. We're doing a lot of what I call swimsuit area exams, and it's just hard when you're a student because you feel extra and you feel like you're imposing your presence on this patient in this intimate setting. Just if you have that feeling, you're doing the right thing, because if just listen to those like social cues that you're getting, you know, give people space, try not to be up in people's business, and we will try to get you involved as much as possible, and the patients will not mind at all, okay, as long as you're having some social awareness, okay?
What do you hate about OB?
When patients don't care as much about their babies as I do.
It's actually, wow.
that's better than what we said.
What'd you guys say?
I said it's just like messy, and you always get
Oh.
splashed with meconium and
That's why you wear booties.
amniotic fluid. And
That's why I wear the rubber shoes.
pretty gross, yeah.
The hours. The hours suck. But ultimately, the hours are what will make you better. They're what will push you, and they're what will improve your skills in the long term.
Know that this place is like a jungle, and it is all about survival, and even us as residents don't have time for learning, so.
But we just want you to know that we are super excited for you guys to come here, and can't wait for the help and the education that we're going to put forth for you guys.
Fact.
This friendly face right here is Miss Edna. She is one of our longest standing. I don't know what's the word, Edna. You're the longest standing. Well, no. Yes, I know you're CST, but you're a monumental fixture in the Polk Dalton scene. I feel like many people come and go, but Edna
She's a
stays. She's a pillar of our community, and she's a pillar of the spine.
Just helped remove a dead cat from the bushes. Happy Nurses Week.
Okay, favorite attending.
Dr. Cunningham.
Her finger stick is a 140.
Okay, thank you.
Perfect. That's perfect.
That was so perfect.
Do I have to prompt your memory here a little? So, triage, Jehovah's Witness,
Oh, that was also my
Breach.
favorite delivery.
breach, extraction, in triage.
That was a fantastic delivery. I can't believe I forgot that one. You were there for that one too.
Yes, so now let me ask you one more time. Who is your favorite attending?
There we go. All right.
I'm not good at this.
I gotta restart. I burped. That's a great start.